Hello and welcome back to A Stride Above. We're going to pick up right where we left off when it comes to joint injections with Dr. Rullan. How's it feel still being in the hot seat?
Oh, it feels great. It feels great. And this is such a hot topic. But it's so good to be interviewed by you.
So we're going to have a lot of fun continuing this conversation. And before, if you haven't seen the episode, we talked about all the different types of joint injections. And now today, I want to get into how do you determine which one to use?
With more than 15 years of equine sports medicine and rehab experience, the visionary and founder of Performance Equine Vet Services, an equine performance innovative center. Your host, veterinarian Alberto Rullan, is here to keep you informed on all things sports medicine, rehabilitation, and equine business. This is A Stride Above.
Great question. This is something that we go with horse owners on a daily basis. Let's say we have a horse with arthritis, which is the most common cause of joint injections. Then we go into explaining, okay, these are the natural products and these are the synthetic products or the drugs, right? And when we talk about the drugs, the cortisone, which has been, for example, most commonly used since many decades ago, there are several products. There's a short-acting one. There are some longer-acting one. And there's some research out there that proves that cortisone has some sort of damage in cartilage. So that's why there's a movement towards using more short-acting ones. And you probably have heard many of these names out there, but they are products like betamethasone, triamcinolone. Those are short-acting ones, dexamethasone. And then there are some longer-acting ones, which the names are a little bit confusing. I'm going to throw it out there, like methylprednisolone acetate. I know.
I'm going to ask you to spell that next.
Yes, don't worry about it. All you need to know is that there are some longer-acting ones. And the theory is that the longer-acting ones would cause a little bit more damage in the joint than the short-acting ones, right? Now, does that as a horse owner, that's short acting, right? That means that it's only going to last what? How long? A month, 2 months, 3 months, 4 months? And every horse is different. Some horses, it lasts a month, 2 months. Some horses, 3 months. So every horse is different. So we try to make it last a little longer by mixing it with other products like hyaluronic acid, the famously called HA. And we're not 100% sure that is actually what happens. So we tried to use that information that I just gave you, plus the budget, because let's face it, injecting a horse with cortisone is significantly cheaper than injecting it with anything else. Right? We're talking about probably half the price sometimes. So everything I told you, plus the price, makes the decision on let's do the cortisone route. Now, when the client is more conscious about the longevity of the joint, how long I want it to last, I really want it to last as long as possible. From my standpoint, I just want to do it once and never see that horse again. I'll be very happy because ultimately that's the best for the horse, right? We fixed the problem, did some rehab, show the client how to make sure it doesn't happen again, and go on to the next. But that's usually not the case because arthritis, which is the most common cause of lameness, gets progressively worse. And if you look at even human athletes, or yourself if you run, or yourself if you do sports, anyone that does sports, they know that an injury will need more maintenance and will get what we call flares. So it will flare up again. It will come and remind you, oh, remember that day? Yes, here I am. So we go ahead and treat that now and again. If it's been a year, then we have the exact same discussion. Hey, you want to do the cortisone short acting? Do you want to do the longer acting? Do you want to do biologics? Or you want to do the synthetics like polyacrylamide? Now, if it's been a very short period of time, now we start really pushing towards we need to try something else because this is not really cutting it for us. It's not healthy to continue repeating treating the horse. So let's start thinking about biologics that we can do more frequent without causing damage, or we try these new synthetics to see if we can get more mileage out of that product. Ultimately, it's not a black and white decision. It's never a black and white decision. It's always in the gray zone. And price has to do with it. Longevity has to do a lot with it. And the purpose of the horse. Especially if the horse is going to certain shows where cortisone is forbidden. Then that way, in that case, we need to start talking about the biologics a lot more than the cortisone. That is when it's become a little bit more black and white, when the cortisone is prohibited.
Understandable. What would make the cortisone prohibited while biologics are not?
Because of the research that's out there that shows that cortisone could cause some harm. Because of that reason, then the government bodies of the entities, whatever it is, the horse show entity, might say, okay, if your horse has certain medication or certain level of medication, we will disqualify you or we will give you a fine. While a biologic is definitely not going to harm the horse. And theoretically, it shouldn't also mask a big injury. Some steroids are potent enough that they could potentially mask a big injury that could hurt the horse in the long term. And back in the days, many years ago, they started a new movement on the race horses because they were trying to determine that horses that were having breakdowns in the track was because these horses had significant higher amount of pain medications than horses that didn't. And that kind of started, at least in the racehorse industry, that kind of started the ball rolling with the steroid situation.
Very interesting. And touching on the biologics, so you had mentioned alpha-2.
Yes.
And that is coming from the horse itself.
Yes.
When you are pulling that blood, are you pulling an exact amount just to do those exact injections that day? Are you able to store it? How does that look?
The beauty of alpha-2M, is that we can draw significant amount. Every horse is going to be slightly different. But let's say a horse, we could do as little as for that day, or we could do a lot more and freeze it for another year, then reuse it, whether we're using it in that same joint or we can use it later on in something different. Like very typical, one of my favorite things is that a lot of performance horses will have, let's say, a neck issue, a little bit of neck arthritis, and let's say they have some hock issue or some stifle. But we want that horse to be treated that same day. Well, alpha-2M is a fantastic product because we can do all of them the same day. Now, most likely with all those, the same day we're not going to have any leftover. But let's say a particular horse has only one hock that needs it, or only one stifle, and that's it. Well, the beauty of that is that we can do that, what the horse needs at the moment, freeze it, and then the horse can come back for prevention if they want to a month or 2 months later, and we redo it to get a longer action. Or if the client just want to come back when the horse is lame again, then we can repeat it, and it's already frozen, so we don't have to repeat the process.
That's very cool. And with that, so you're implying too with the biologics, so that's not something we could have done with the cortisone, is be able to attack all of those spots at once.
Absolutely not. There's also another drawback of a cortisone is that there is also a limit that we can put in the body, because the cortisone will actually not stimulate, but the opposite of stimulate will inhibit certain physiologic processes in the body that will make the health of the body, the immune system of the body, and some pathways in the brain actually to change the hormone and the own production of cortisone of the body. So long high amounts of steroids will make a horse sick.
Wow, very interesting. Well, thank you for letting me put you in the hot seat for a second time or a third time. I can't even keep track now. And thank you guys for tuning in. We look forward to bringing you guys more content. Be sure you're following us on social media and letting us know what you guys want to hear. Have a great day.